My name is Kristin Snowden. I'm a licensed marriage and family therapist in the state of California and certified life coach. And we talk about all things related to relationship. But today I'm going to really focus in on helping you understand why, when you're in crisis, when you've just uncovered an infidelity within your relationship or an unknown addiction, porn addiction, sex addiction, substance abuse addiction, that I want you to be very careful when you're seeking out professional help. Infidelity and addiction are not just couples issues. Yes, they deeply impact the relationship, and the healing has to eventually occur within the relationship dyad to move forward. But I want you to understand how and why they have to be handled differently, and often with specialists who specialize in this topic, which is exactly what sexandrelationshiphealing.com is about, seeking integrity, my website, etc. Many of you are here because your life has been turned upside down due to uncovering unknown addictions or infidelity. You're lost, you're looking for help, you're exploring whether or not you want to reconcile and heal with your partner, but you don't even have any idea where to begin or what that process might look like, right? We never read a book on this. We were never taught how to do this. It is new territory. Or maybe your partner may still be justifying his or her acting out behaviors and maybe isn't anywhere close to owning what they've done and are moving towards wanting to work things out. Regardless, if you're lost and looking for clarity, these are a few of the initial steps that I think you should be taking to move forward from crisis to recovery. I want you to understand that you have to be very careful to not approach infidelity and addiction in the same way that we approach other issues, depression, exploring kind of more common couples issues, anxiety. Each of these types of therapies and therapists and recovery processes are different and have to kind of be respected. Because as you know, in moments like these, moments like what you probably are going through, listeners, the audience, in moments of uncovering addiction, infidelity, the days, weeks, and months that follow after finding out about this affair, porn use, sexual acting out behavior, massage parlors, and the subterfuge, the lying, deceit, gaslighting that often comes with those types of behaviors, those all contribute to a lot of really messy emotions coming out at different times from both betrayed partner and acting out partner. Often there's threats made. Sometimes there's acts of violence. Sometimes you make a decision and you're like, this is what's going to happen. We're divorcing. And then the next minute, everything changes and choices and decisions are changing every minute or every single day. Defense mechanisms are running wild: minimization, justification, blaming, rationalizing, etc. And above all else, your nervous system, your survival system in your body is just wrecked. It's really hard for you to use your executive functioning skills, to calm down, to create stabilization. So you must put yourself in a support system that is familiar with the pattern that I just explained. Because one of the worst things that can happen is you go into a family member or a therapist that isn't trained in these types of therapy, and you get blamed and shamed. You're told what you should do, what you shouldn't do. There's a lot of judgment. You need people who specialize in this so they understand these patterns. It's just kind of normalized that this is how it tends to go. And they know how to respond appropriately and productively. Productively is a big word. So again, I keep saying this, but just be careful about when you uncover this and you're in the middle of a crisis, that you don't just kind of get referrals from anyone who's maybe, oh, my child therapist is good, or hey, I looked this up online. This is a person that's nearby my neighborhood, because that might not always be the best answer. I've watched enough of these crises unfold over my over decade of work in infidelity and addiction recovery to see that general couples therapists may not appreciate the nuances, the traumas, the emotional manipulation that occurs, and the emotional dysregulation that tends to be walking into his or her office after these crises are uncovered. Nor do they actually quite appreciate the nuances and sensitivity in figuring out the right time when individuals need to go off into their separate spaces and do individual work, and when is the right time for a couple to come get together to do couples reparative work. So that's what's really unique about these types of crises. So when you're looking for a therapist, when you're looking for specialty help, and even when you're looking for recovery communities, support communities, such as sexandrelationshiphealing.com, you want to make sure that there's a specialty or an understanding that of how to approach addiction recovery, betrayal trauma, intimacy disorders, infidelity recovery, etc. Because there are important protocols and order of operations that we tend to use in order to prevent further trauma, improve recovery outcomes, and above all else, ensure the safety of all the parties involved, the betrayed partner, the acting out partner, anyone else environmentally who's around, families. Consulting these specialists are imperative, and honestly, not consulting specialists may lead to more harm being done during the process of trying to heal or recovery. So let me just kind of walk you through, as someone who's been working in this field for over a decade, when someone calls me or sends me an email, I want to walk you through what my general thought process is to help you. Because I hope when you get on the phone call with a therapist, I hope you're getting these questions asked, so you can kind of understand. And of course, I let Tammy Vera Health, who usually co-hosts with me, and Scott have been also working in this field for many, many years. They answer the phone calls. They help provide referrals as well. And maybe Scott will chime in and kind of let us know what his opinion is on this as well. But generally speaking, when I get a call, usually it's from the betrayed partner, it's from the partner who's been harmed. And they just found out, they just uncovered a 3-year affair that they were unaware of, or porn addiction, maybe they didn't know how bad it was, or that their partner is going to massage parlors, or acting out in various ways, or they got in trouble at work because of inappropriate internet discoveries or affairs, etc. These are kind of the general questions that I'm asking because I'm trying to vet and assess where is everyone at the situation. So first, I'm going to kind of ask, when did this discovery occur? Well, what are some details? Like, how long has this been going on? When did you find out? What has the household been looking like? What has the relationship been looking like after this discovery has occurred? I want kind of I want to put my finger on the pulse of how intense the situation is and how everyone's kind of managing this discovery. How's the betrayed partner responded, and how has the betrayer responded to this uncovering? Then the next question is, do both partners want to work towards healing? Have they expressed a desire to repair, or is the betraying partner still off, kind of acting out, not paying attention, just kind of, you uncovered what's happening, but there's no change? Do the partners have any kind of similar goals? Is there even, we can even just work with a tiny bit of desire to, like, okay, maybe I feel bad for what I did. I'm not sure if I want to let go, or I'm not sure if I have a serious problem, but, right. So I want to assess, is there any overlap in goals here of how each partner is trying to move forward after uncovering this crisis? And what are they willing to do to heal, to go further, to explore this, accept influence, get support, guidance, etc.? The next question is there honesty and accountability from the acting out partner at all for what's happened? Or is there continued minimization, justification? Is the betrayed partner kind of doing all the work trying to find therapists and get help and kind of pushing and prying the acting out partner to get the help that they need? That's really important. Um, I mentioned this before, but what is the home environment like? You're going to hear a lot in these crises moments. It's not about getting this couple into couples work to repair the marriage. A lot of the initial steps is about stabilization. There has been a bomb that's gone off in the house. You don't kind of sit there and go, where'd the bomb come from? How big was the explosion? You're picking up the pieces and you're making sure that the gas lines are turned off and that anything that could create any kind of future safety issues is seen and explored and there's kind of accountability structures put up around that to prevent any potential safety threat issues. There's a lot of times and moments where there's, the betrayed partner just trying to keep it together, maybe put one foot in front of the other, or maybe the acting out partner is just trying to keep their head down and prevent further explosion. So there's usually moments of peace and then moments of explosion, violence, threats throughout the day, throughout the week. That is a common op-tempo post-crisis uncovering. The next question is the betraying partner, is the person who had the affair or is acting outside the marriage, are they still acting out? What does that look like? Are there a lot of kind of promises? I'm going to, what's the history of that? I found out about the affair a year ago. They said they weren't going to see the person anymore. Now I just realized that they were. I want to get a better picture of where that is out because that has a lot to do with stabilization. If the betrayed partner is still living with someone acting out, there's maybe an affair partner out there that those are feelings of unsettling, unsafety. That's going to be really hard for that betrayed partner to feel safe in that environment. Another important question is, what does their support system look like? Whether it's the betrayed partner or the acting out partner, I want to know who's around you, who's currently helping you. Do you have a therapist? Do you have a psychiatrist? Do you have a community, a family members that can come in and help you with the kids, that can help you just kind of get breaks? Are there people that can kind of listen and support you, meetings, etc.? What does their current support system look like? And another big question is, how is this person coping? When I'm talking to them on the phone, assessing the situation, are they not eating, not sleeping? Are they raging? Are they struggling to put one foot in front of the other? Because I want to know, is just coming to therapy one time a week in an outpatient setting with me, is that going to be enough to help stabilize and calm them and create a safe space for them? Because as I'll mention further, sometimes these crises, you uncover an addiction, but your nervous system has already been in a struggling place and space. And so this just kind of pushes you off the edge, which is, again, you're not bad or wrong. This can be very normal, but sometimes you'll require more help and support to stabilize. And plus, what is the betraying, acting out partner doing to get help? How are they coping? How are they managing? Are they increasing their drinking? Are they running, disappearing a lot? Are they shutting down and just avoiding? I want to know that. And then I also want to understand the general environment around you. So what does your environment look like outside this crisis? Are there additional components that are important to know? Are there kids in the house? Young kids, old kids? Are there additional stressors that you might be dealing with that might compound the crisis that we're dealing with? Maybe young kids, special needs, jobs, health issues, financial issues, big life transitional issues. Plus, this is another thing that only specialists in this area can assess, which is when I'm talking to these people, I'm trying to figure out, is their betraying partner, the person acting out or the person who had the affair, is this more of a chronic pattern that's more like an addiction type pattern? Has there been multiple affairs? Have there been years of maybe some substance use mixed in with massage parlors or acting out? I'm trying to, or is this like a seasonal issue, an immediate life stressor that led to some kind of affair or led to some kind of, increase in substance use, etc. Usually it's only specialists that can ask the kind of right questions to understand, is this a single incident, kind of a acute crisis problem that can be dealt with? Or is this more of a chronic pattern that needs much more structure and support and kind of accountability systems underneath it? So, one of the biggest mistakes that happens is that a lot of these people, when the relationship dyad explodes because of the crisis, is they're often pushed into or just go into couples therapy to do couples work. Why that is not a good idea is because the infidelity or addiction part is not a marital issue. This is, yes, granted, stuff happens in a relationship. You struggle, I struggle, and these contribute to my mental health and emotional status, which might contribute to my decision to go out to have an affair or to abuse substances or to, turn towards porn. But it is still not, that is not a marital issue. They're two separate issues. There's the fact that, yes, maybe our marriage might be struggling, or maybe we're realizing there's problems in our marriage. However, these were coping skills, unhealthy coping skills. And usually it's unhealthy because there's lying, sneaking around, you're not living in integrity, you're going against your values, you're going against your commitments and promises. So unhealthy coping skills that you are using to deal with life. And so it's important to first deal with and focus on the fact that there was a major, major breach in commitment and betrayal that occurred. And that has to be dealt with first. And there has to be an understanding of the infidelity or addiction or acting out behavior separate from the relationship dyad. And not, again, many professionals appreciate that. Just remember, like Rob always says, you could have a bad marriage. It could be a sexless marriage, but you always have choices. You have choices of how you want to deal with it. You can deal with it upfront, honestly. You can get therapy. You can get a divorce, but you make choices to lie, to gaslight, to go behind someone's back, to lead a double life, outside of your marriage and commitment. So keep that in mind. And so it's often further damaging after uncovering addiction and infidelity to sit in couples therapy and have to hear your partner blame, oh, you never had sex with me. Oh, you raged at me. That's why I was justified to go out and do these behaviors. Your partner, the betraying partner, the acting out partner, is usually pretty compartmentalized, and they're still kind of wrapped up in their lying, their manipulation. They really struggle with understanding. So having empathy for what's happened, what they've done to to the family. There can be a lot of judgment there. And so jumping into couples therapy is not good for that reason. Another reason is because often, at least my experience has been, when infidelity or betrayal or addiction is uncovered, they usually aren't willing right away to let go of that acting out behavior. They're not instantly going to like, oh, I'll cut off the affair partner and never speak to the person again. Oh, I'll stop the substance abuse. Oh, I'll stop the. So it's also very unproductive to be trying to engage in repairing a relationship when the person is still turning outward in the relationship. They still have intensity seeking behaviors, focus, a huge part of their brain is not even in the marriage. So how on earth could you repair a relationship when they aren't even present still? So that's a big reason why you got to kind of deal with the peripheral issues. Then you can get to the marriage. Now, this is a caveat to this whole, stay away from couples therapy. It's not uncommon to go to a couples therapist or, a mediator, so to speak, an unbiased central person to discuss like here and now issues, like rules of engagement after uncovering this crisis, boundaries, non-negotiables, day-to-day issues that might be popping up, in-house separation, therapeutic separation, co-parenting, setting up an accountability system to figure out if the person's still lying, ending the affair, how to communicate to the affair partner to end the affair. Those are okay because they're here and now issues. But diving into the whole like what went wrong in this marriage, to me, I was trying to think of like a metaphor to help you understand how unproductive it would be or just how it'd fall on deaf ears. And the metaphor I thought of, it'd be like you got in a major car accident and you're being rushed to the ER to deal with physical injuries from a car accident, right? An immediate acute crisis issue on your body. And the nurses and doctors are kind of checking your body to make sure there's not broken bones, internal bleeding, just things that are very immediate problems. And while you're being assessed for injuries, you kind of go, hey, there's a suspicious mole on my back. Can you kind of like check and make sure that's not cancerous? Or like, hey, I've been having intestinal issues. Can you maybe give me some nutritional advice? Like while you're checking for internal bleeding, maybe. Yes, these are questions to ask. And yes, these are medical issues that should be dealt with. But we are triaging here. We need to deal with the things that are going to kill you most immediately, the most immediate problem. And then, yes, when we've stabilized, we've made sure that you're safe, you're not bleeding internally, there's not broken bones that have to be repaired, then we can explore that suspicious mole that might be cancer or not and deal with your nutritional problems. So I hope that helps you understand like why we don't just dive into the marriage issues or, why I keep dating addicts or, why my abuse in my childhood contributed to why, there is an affair or something like that. So these are the things that I like to see happen before you start working on the relationship. First and foremost, the behavior, the acting out behavior, the outside the marriage behavior has to stop. The affair has to end. The porn use has to end. The acting out behaviors all have to end because hopefully I explained that well and you understand why. Second is there has to be an accountability structure developed around that so the betrayed partner can actually feel like the person is stopping that behavior. So that can happen in a number of ways. And again, a professional can help you with this. But is the acting out person seeing a therapist regularly? And then they're checking in, they're asking the questions. Have you contacted the person? There can be internet security created for the porn use. A sponsor or going to 12-step meetings where they're regularly checking in with people who kind of struggled in the same way so they can call them out on their BS and make sure that they're not up to their usual shenanigans. Or a close trusted friend. It's not unreasonable after instances of deep betrayal and where someone is shown that they're capable of lying, sneaking around, being highly manipulative, that their phones are being checked, their credit cards are being checked, that someone's checking their whereabouts, where they are, that they truly are where they're saying that they are. That doesn't have to be the betrayed partner. It doesn't have to be their spouse. It can be a therapist, sponsor, friend, 12-step community fellow, etc. Which goes to my next point of what I like to see. I like to see group work. I'm a huge fan of group work. And that can include either going to groups like, again, sexandrelationshiphealing.com has some really great affordable workshops. I always have some workshops for the betrayed partners, Life Anonymous groups. There's 12-step meetings galore, a ton for the people who have been betrayed, for the people who are struggling with infidelity, addiction, etc. This is for both. This is the more helpful community you can put around you. And they don't have to just be paid specialists. They can be helpful to you. They help with stabilization, like they can calm your nervous system. They can help you relieve shame. They can help you with trauma. Your home life and your partner who's been acting out, or your betrayed partner who's really, really angry at you, is not going to be a source of stabilization or attaboy and good progress for a very long time. There's a lot of hurt and pain and anger and shame that's going to exist because of the nature of the damage that's been done. So you usually need to find an outside group, an outside source for stabilization, help, clarity, guidance, etc. This also can help you lower defenses because when you're in a group of people who've struggled similarly, or when you share stories, you realize I'm not alone. And it can also help develop empathy and compassion for what maybe the betrayers have done to their partners because they hear other people's stories. Plus, it helps with shame resiliency and trauma recovery. The other thing that I like to see is physical and emotional stabilization improvement. So I want to emphasize this. It is normal, not wrong, not bad. There is nothing wrong with you that you've been on an emotional roller coaster. That one minute you're desperate to save your marriage, the next minute you're like kind of fantasizing that your partner would die. That is all a common roller coaster of up, down, crying, then getting your stuff together to try to take care of the kids and function and do your job. However, as long as you are in this roller coaster, doing couples work is just not going to be productive. Repairing the relationship is not. Your prefrontal cortex has just been hijacked by that survival lizard brain that's like just constantly kind of life or death scenarios happening day in, day out. How do I keep myself safe? How do I keep my family safe? How do I stay functioning? So again, you need to be asking yourself, how do I get to that stabilization place? Some people just need once a week therapy. Some people need regular community group support, as I just mentioned. Others might need a higher level of care. And there's nothing bad about that. They might need to go to a residential treatment center for 30 days, 45 days, 60 days to just, again, be able to build and develop the tools to get through this uncertain time, this really painful, difficult time. Now, when I keep saying stabilization is necessary, I want you to understand what I mean by this. I feel like sometimes stabilization can have like a negative connotation, like it's saying that you're the problem or you have a problem and it needs to be, stabilized, or the maybe like mentally unstable, right? And it needs to be stabilized. That's not the case. I am normalizing every person who has gone through this crisis. A normal nervous system will run wild. This is, they've been blindsided, they feel powerless, they're scared, their lives have been threatened. It is the same thing as, your nervous system will receive it in the same way as being held up at gunpoint. It is okay to feel unstable, but then it is your job, because this is a marathon. This isn't a sprint. There's going to be long-term uncertainty, ups and downs, pain and difficulty, that you have to start developing and collecting the tools of, okay, when I get overwhelmed, when I hear that song, when I remember that horrible memory, when that person makes that face, when he does X, Y, and Z, when she does X, Y, and Z, it flares up my nervous system, that you have the tools to bring it back in and stabilize so you can regain agency over yourself and kind of turn this prefrontal cortex back on so you can be productive in individual therapy work. You can be productive in couples work, should that happen, or be productive in just your everyday life. So again, additional therapy might also help develop boundaries, what's okay and what's not okay. I need STD testing. I don't want, this is what's going to happen if I find out you're talking to the affair partner again. These are the consequences, helping to set up and hold boundaries, develop the plan for like the next best steps. What's normal? I have a lot of clients that are just like, what's normal? What does this look like? Because they just don't know. It's also, this is an uncommon practice, but we tend to do this in the world of infidelity and addiction because, again, there's a lot of lying, manipulation, minimization. Is all therapists usually should be in communication with the other. So individual therapists are in contact with the other individual therapists, couples therapists, et cetera, to kind of make sure that everything's on the up and up, that there's honesty and the story's being told correctly, so to speak. Eventually, you move towards what we call therapeutic disclosure. And then once that's completed, then you tend to move towards going to the couple's issues, going to the marital problems that might have existed. What doesn't happen right away is you don't kind of explore why, my childhood wounds caused me to love an addict, discussing where the marriage went wrong or how he or she didn't communicate the right way or how there's no sex life, etc. And those are generally the immediate crisis, path from crisis towards the steps of recovery. And I'll answer any questions.
I just want to reiterate some of what Kristin said here. When infidelity is involved, there are three entities that have to deal with something. There's the cheater who caused the crisis, there's the betrayed partner who did not cause the crisis, and then there's the relationship. And things can run off the rails when you go to therapy. You can either get the wrong therapist, which is somebody who's not a specialist in sex addiction and infidelity. And oh boy, can that be counterproductive. Oh, it's okay for you to look at porn. Don't worry about it. I mean, I can't tell you how many guys have come into like my porn work group. And by the way, Kristin's Life Anonymous group for betrayed partners, awesome. Highly recommended. But they'll come in and they'll be like, well, I went to a therapist who said, oh, I just need to feel better about using porn for 12 hours a day or, 20 hours a week and ruining my marriage. I was like, no, that's the wrong therapist. We're dealing with an addiction here. We need a proper specialist. So the wrong therapist can be bad for the addict. It can be bad for the betrayed partner. It can certainly be bad for the relationship. Betrayed partners also need the specialist. And I think, like Kristin, I recommend a CSAT, somebody who understands the specifics of what that betrayed partner is experiencing. Now, just to be clear, the addict needs treatment. The betrayed partner deserves treatment. There's a difference. Betrayed partner, you didn't cause this, but you are in crisis and you deserve some support. So by all means, you should get it. And then when I am stabilized as an addict, not acting out, I got a couple months sobriety and being accountable, all these things that Kristin was looking for. And probably by that point, my betrayed partner is somewhat stabilized and has a support network. Then it's time to bring the third entity in, which is the coupleship. And until I am, as an addict and say Kristin as a betrayed partner, are stabilized enough in our individual crises, there's no point in working on the together crisis. With the one exception that Kristin mentioned, which is you might go to a couples therapist right away to set some boundaries. Here's how we're going to interact. I'm going to move out or this or that. So you want to jump into the Q&A?
Sure.
Okay. Betrayed partner and spouse here. Congratulations. I'm happy both of you are on. Can you spoke to this a little bit. Can you speak to what accountability looks like? So elaborate a little bit.
Right. That's really going to depend on the acting out patterns and behavior. So whatever the major issues were that come up, that I never was where I said I was going to be. I was always coming home late. I have inappropriate things that I'm doing on the computer or with my phone or an affair partner. Depending on what the concerns were, that's the accountability that you create, right? So it's like if I have issues with porn, then I'm doing like a security firewall system where someone's, making sure I'm staying good with what I'm looking on the computer, or won't even let me look on the computer. Having someone regularly ask questions. As my job, I regularly am checking in. Have you spoken to the affair partner? Are you going to meetings? What are you talking about in meetings? Making sure that they're not just checking things off the list. But if I talk to them and ask them these questions, I find out is there actually like soul changes going on? Are they doing different frameworks? Are they humbling themselves? So accountability will often look like figuring out what the unhealthy behaviors, lying, sneaking around, manipulation behaviors are, making sure that's not happening specifically anymore with whatever accountability structure that might be. Don't go there anymore. Don't go to that site anymore. Don't contact those people anymore. Don't drive down that street anymore. Don't drink that alcohol anymore. And then you have people in your life who are checking in on it regularly.
Yeah. Um, and the purpose of accountability is to start rebuilding relationship trust, because that's the ultimate problem in the relationship is there's no more relationship trust after you cheat. I mean, you just blow that up. Um, I always tell my addicts, you want to speed up the process. You want to stop your wife Sherlocking and, peppering you with questions every 3 minutes. Start being honest. Be rigorously honest. Tell the
Mm-hmm.
truth and tell it faster. So that's part of being accountable is just saying, "Yep, I'm not perfect. I screwed up today. Here's what I did."
Yeah, and I always say too, it's a shame resiliency practice. There's a lot of shame in, I'm bad, I'm wrong. If he or she really knew what I've done, they wouldn't love me. And it's really important to do this accountability, keeping promises, commitments, not lying, because you want to be able to say that those are behaviors and choices that I made previously. That is not me anymore. That I am now living honestly, I'm living in alignment with my values and goals, I have integrity. And that really helps when shame comes knocking at your door and whispers, you're a
Yeah.
horrible human.
Next one here. As an addict, at what point in time do you start therapeutic work on inner child trauma, on childhood trauma? When does an addict start working on childhood trauma? And the trade partners too, for that matter. Might as well ask both.
Yeah, I mean, I would say I think it's anytime after there's immediate stabilization, right? Like if the environment is no longer, because obviously, if you're going into your inner child trauma, that alone is going to be very dysregulating and upsetting. So we want to again, we don't we don't want to check out the suspicious mole that might be cancer until we make sure your broken bones are taken care of and your internal bleeding and the immediate crisis is stabilized. So that is the goal, is that if maybe the home environment, maybe you have some sobriety under your belt, whether it's 60 days, 90 days, a year, it depends on how unstabilizing it is, that your partner is also more stabilized. So the home environment is not just like World War II every second of every day. And that you actually have a prefrontal cortex turned on so you can start sitting with exploring and kind of experiencing soul changes when you do inner child trauma work. I was just even thinking the 12 steps, there's a reason why it's like 1, 2, 3, and then 4 is because it's like, okay, I have a problem, but I got to get my people around me and I have to learn how to accept influence from them, create this community of safety, accountability, humbleness, and surrenderness to, my fellows and a higher power before I do step 4, 5, and 6, before I start going through the crap that's happened to me, the harm that I've caused others, that there's a reason why it's in that chronological order.
This next question is right on target with what we're talking about. I'm the partner. My CSAT says I need to do EMDR on my childhood trauma so that I can work on being strong with boundaries. However, I feel too scared to go to my childhood trauma while I feel so unsafe with an addict that says he's sober but not doing things for recovery, etc. So, what advice do you give this person? She's got a I'm
Mhm.
assuming this is a she. She's got a CSAT who's saying it's time for EMDR, but she's
Right.
saying, I'm not sure it is time for EMDR.
But I'll tell you what my gut's telling me, and this is just totally shooting off the hip, is I wonder if the CSAT has really been encouraging this person to be setting boundaries and consequences when their partner continues to relapse over and over and over again. And they're sensing an overwhelming sense of fear, like fear of abandonment, fear of rejection. Um, that might be hindering and stopping their ability to identify and hold boundaries and consequences. So that is kind of a unique experience, when a therapist is noticing we're kind of doing the cycle of insanity, we're doing the
Yeah.
same things happening over and over again, that means you're jammed up in here. Things going on in here are stopping you from keeping yourself safe, from speaking up and having a voice, from holding these boundaries, from pushing and following through with consequences. So sometimes that EMDR trauma work might be a next step. That's just my opinion, though. EMDR can kind of shake up the jamming stuff
Yeah.
going on, that at least you know what's coming up when you're setting that boundary. Because remember, every time you set a boundary that's saying, I have a need to be met, can you respect this? And if the answer is going to be slap down no, then you have to deal with the huge wave of like, why don't you love me enough to respect my boundaries? Why, the rejection that you feel. So that stuff has to kind of be dealt with.
Yeah. Just make sure you have a lot of support around you.
Exactly.
A lot of social support beyond your partner, who's not going to be providing it while you're doing it in DR. I mean, that's not the person you want to go to when you're struggling. Um, so my husband and I were doing Fanos check-ins and found them helpful until I felt a shift in his behaviors. I no longer felt safe doing these check-ins and stopped them. I later found out that he lost his sobriety and was lying to me. He now feels that he does not need to tell me about his sobriety because I stopped the check-ins. I don't feel safe doing Fanos with an active addict, but would like to know the status of his sobriety and recovery. Am I correct to stop Fanos? How can he keep me updated on recovery? This is a really interesting question.
It is, except I feel like it's really simple. Should I have an open and honest and vulnerable conversation with someone who I think is full of it and a big fat liar? Because I'm sitting here trying to be honest and vulnerable. Because the purpose of Thanos is to recheck in, right? Is to have, like, do I see you? Can we sit in a space and talk about things and do hard things and rebuild trust and connection slowly through these Thanos check-ins? That's vulnerable. That's scary. And I'm hearing this person say, I think this person is just full of it. So I don't really like, everything out of their mouth is just a lie or a manipulation, or it's just them not meeting me, reciprocating the vulnerability and honesty. So, yeah, I mean, of course, it feels unsafe when you're seeing them engage in these kind of manipulative or dishonest or just inauthentic behaviors. You can't help but also wonder, are they relapsing? Are they living the double life? Are they back to their nefarious behaviors? So you want to ask those questions. You can ask, but it sounds like your gut's telling you you're not getting the clear and honest responses you're hoping for.
And one of the things we often tell partners is when your gut is speaking to you, listen, because it's probably right. And your gut was speaking to you and it was right. You stopped the Thanos because you felt he was lying. And you found out later you were right. So this last one's not a question, but it says, would Kristin please reach out to me about couples work? Need her forthright, clear help. I will. Can you talk about your practice? You're in California, so you can work in California.
Yes, I'm in California. I actually only do couples work in person because I think it's really, really important because as you hear, there's a lot of nuances to it. And I want to pick up the energy and the nonverbal language happening in the office.
Yeah.
But yeah, I also have lots of live workshops. I have a Betrayed Partners group that's going to be starting soon. Right now, I'm doing a Life Anonymous group based on the book that Scott and I wrote together, where we kind of go through all the exercises. But again, speaking of this is more individual work. It's done with an understanding and appreciation of infidelity, betrayal trauma, intimacy disorders, addiction recovery. But this is meant to be done further down the line after the crisis has been stabilized.
Cool. All right, we're out of time. Kristin, I always love being here with you. Kristin's my co-author, my favorite co-author, my only co-author, but my favorite
Oh,
one.
thank you.
Reach out to us at Seeking Integrity, sexandrelationshiphealing.com. Reach out to Kristin at her website, kristinsnowden.com. And thank you, everybody, for being here, for all your great questions.
Thank you. Thank you so much. I appreciate you coming today.
Cool. We'll see you later, everybody.